Hi, Dr. Mark Agresti. I wanted to do this video to give people tips on how to help a person with mental illness and how to interact with them. This is very difficult. When you have a family member with mental illness, all logic and all common sense really no longer applies because it's now your family member, your son, your daughter, your wife, your husband, your aunt, your uncle, your grandparents. All of a sudden now you're dealing with it in your family. It's not so easy. You're not, the rules don't apply and common sense doesn't apply because you're too emotionally vested. You're too connected. I recently had a man come in, his son is psychotic, and they're letting him walk around the house, smoke cigarettes, not bathe. That some people just can't deal with it. And he goes, well, how am I going to deal with this? And I recommended things. He goes, I can't possibly send him to a treatment. Well, so what goes on? There's all this fighting going on in the house and yelling and screaming, and he's destroying their video systems, their technology, their garage, their cars, but they just tolerate it because it's their family member and they're willing to tolerate just about anything because they don't want to send or do anything that their family member doesn't want. It's very difficult when the person you're trying to help has no insight and has an illness which makes them really somewhat of a threat to themselves and to everyone around them. Because these individuals become aggressive, they have poor hygiene, they don't maintain their bodies, they don't maintain their environment, they leave food, chemicals, flammable things, they pick up weapons, they drive dangerously, they move dangerously, they may assault or provoke someone or agitate things for absolutely no reason because they're psychotic and they make no sense. So without making sense, you could walk in front of a car. You could start a fight with people in a supermarket who would hurt you badly. You could pick up a knife and threaten a family member. You could run around the neighborhood with no clothes. These are all true stories. You could start screaming at the neighbors thinking they're watching you and going to attack you. So it's very difficult to deal with a family member. It is extremely stressful. It takes years before people decide to do anything. And they suffer incredible. And there's some things we can do to avoid that. Now, what would they be? Let's start with some basic interaction skills. Whenever you're interacting with someone who has mental illness, talk to them in a comfortable place. A place where you're likely not to be disrupted, interrupted, where there isn't a lot of ancillary noise, there aren't a lot of distractions. So a safe, quiet, peaceful place. Be sure to speak to them in a very calm, relaxed manner. One of the worst things you can do is have anger, frustration, aggressiveness, hostility. It doesn't work. Communicate in a very straightforward manner and stick to one thing at a time. Always being respectful and empathetic. It's critical here to be a good listener, a reflective listener. Moments of silence are better than moments of loud, rapid speech, which are no good. It is critical when you're listening to them, and they could be talking about the most bizarre, ridiculous, inappropriate, psychotic, distorted things. Be a good listener. Maintain good eye contact. Ask appropriate questions, but don't keep digging deeper into them. You're not going to resolve anything by learning how their inner mechanisms work. You'll just provoke them. Don't press them. Always give them the opportunity to speak. Don't interrupt them. When they want to speak, let them speak. No matter how inappropriate, if they're talking about paranoia, surveillance, high energy weapons, aliens, conspiracies that the government is run by aliens, or that there's a conspiracy to put them under surveillance and take them away and lock them up. Agree with them and say that could be true, but do some reality testing where you say, I feel that may not be true. That is a possibility. Try and at least get that. Do not confront. So you never agree with them that yes, aliens are sending high power beams. I had someone here yesterday. He believes he's under surveillance. He believes the government is shooting him with high energy beams and causing him to have testicular pain and abdominal pain. And I said, that's possible. That could very well be possible. But I said, there's a chance that may not be true. Approach it like that. Never put them on defensiveness. Always get common ground. It's critical. Don't speak down to them. Speak at their level. Don't try and intellectualize and speak above them. Always try and speak to them at their level. Be very careful. If you see them getting agitated, upset, confused, back off. It's not the right time. It's not on your schedule, it's on their schedule. Mental illness cycles, all of it does. Comes and goes. So during a good period is when you can have a conversation with them. All these things, what they're doing is building rapport, a respectful relationship where there's an understanding that you genuinely care about them and you are concerned. They will sense if you're dismissive, condescending, that you don't really care. They'll pick that up. Offer support. It's only through developing an intense relationship with this individual will you have any hope of getting them into some type of formalized professional care, which is the goal here, to get them to see a therapist, to get them on some medication, to get them to a day center, a walk-in center, a day program, an intensive outpatient program, intensive outpatient therapy, something. And it is key to always say, things will get better. These illnesses resolve. Now, I've had some families, and I try and work with people on things not to say. Don't call people crazy. Don't use terms. Don't make a joke of anything. Don't tell them they need an attitude change, or that that's ridiculous, or that's totally off the wall. Those things don't help. Criticizing, blaming, raising your voice, it could be the worst thing. Express emotion, hostility, frustration, talking loud, rapidly, that doesn't work. Talk in a calm, positive, hopeful, endearing, concerning, empathetic way with pauses. Silences are okay. Showing any form of hostility will just push them away from you. It doesn't work. Sarcasm, making jokes, please, that will not help. And talking to them in patronizing or condescending ways, like, are you going to bathe today? You smell. Did you take your medicine? Have you gotten a job? Have you even looked for a job? Do you even know what work is? Are you going to smoke another cigarette? Is that all you do is watch TV? Did you ever think about putting new clothes on? These things really don't work. And one of the key features here is, through this relationship you have with this person, the hope of everything we're doing here is to get that individual into the office or connected with professional care in some way, where they can get the therapy, get the medication, get the walk-in centers, get the day hospital, the intensive outpatient treatment, the outpatient treatment, something. And remember, nothing happens quickly. You want to get them in with some mental health provider that establishes a good relationship. Nothing will happen quickly. What does need to happen is a relationship with someone in the mental health system must develop. Encourage the relationship, and through that relationship that you have and the mental health provider has, you work as a team to get them to progress and to advance in treatment in terms of therapy, medication, and different treatment programs. It's your only hope. Just a caveat of mine, when these things don't take place and we don't look at treatment first with a mental ill person, do you know what happens? They wind up on the street. They wind up wandering neighborhoods. They wind up directing traffic. They wind up living in homeless encampments. They wind up on drugs. They wind up on alcohol. They wind up non-complying with medication. The only way to solve mental illness problems is to treat it first. Giving someone with mental illness a home does not help them. You must treat the mental illness first. Giving them food. Really, treat the most important thing with someone with a mental illness is treating it first. Because nothing from that point will go forward without that illness being treated. I hope that helped. That is just a little, I've given some skills and some caveats to help deal with people with mental illness, to prevent a total meltdown. Thank you.